So I will try to present how Open RAN can be used in fourth class municipalities such as Danao Bohol, and what its implications can be for digital health in improving digital connectivity. So once again, I'm Dr. Rina Juno Sumatra, a doctor to the Barrio of Danao RHU. Okay, so before I begin, I would also like to share what the Doctors to the Barrios program is. So this program has actually been started by Dr. Juan Flavier in 1993 as a response to the lack of doctors practicing in poor rural communities. So back then, there was a trend noted na the doctors usually study medicine here and then go to the US to work as nurses. So there was that trend at some point before. So the Doctors to the Barrios program somehow was established so that the doctors would find it interesting to work in a rural community because the pay is high, and there are also multiple career development or competency development for them. So the Doctors to the Barrios program has identified priority areas in the country needing doctors. So one of the criteria to be considered a priority area for a deployment of a DTTB is that the community is depressed, unserved, or underserved, and they are usually hard to reach or critical fifth and sixth class municipalities without doctors for at least 2 years, or the same municipalities but with MHOs or RHPs who are on study leave. And finally, even third and fourth class municipalities could also be considered as a priority area as long as the doctor to patient population has not been achieved. So our ideal ratio is 1 is to 20,000. So if, for example, we have a third class municipality with more than 60,000 population with only one doctor, they can still be considered a priority area for the deployment of a DTTB. So the objectives of the program includes ensuring quality healthcare service to the depressed, marginalized, and unserved areas through the deployment of competent and community-oriented doctors. So effectively, in the municipal level, we are also looking into developing the health system of the area. So we're not just doctors who conduct consultations or treat patients as they come. No, we don't just focus on the sick. We also look at the population as a whole, and as much as possible, we focus on health programs that aims to prevent diseases before they appear. So here in the picture is one of my barangay visits. So as you can see, ano lang siya, very nature. This is one of the geographically isolated disadvantaged area in our municipality. So we also conduct home visits and barangay consultations. And sometimes home visits, most especially for bedridden or for PWDs who find it hard to go to the RHUs to get access to healthcare. So, in addition, I'd also like to share. So, under the same program, we are also trained to improve our basic competency level. On the left is our picture from Region 7 DTTB is here, together with our base hospital, Vicente Soto Memorial Medical Center, where we are trained for 1 year under a practice-based family medicine residency training program. And then at during our second and third year of DTTB, we have master's program. So I am from batch 39. So currently we are with Ateneo School of Government, having a master's degree in public management, major in health governance. The previous batches of DTTBs were with UP, where they had masters in public health, and the previous batches pa were with the Development Academy of the Philippines, or DAP, and they also had master in public management courses, major in health systems development. So we can see how the Department of Health is trying to um, improve the capacity of our health workers on the ground to help develop health systems. So I'd like to share lang. So this is from my batchmates from UP College of Medicine. So sa batch namin of 160, only 8 went into the DTTB program. And so this is me, and I'm deployed in the Danao Bohol. So this is a mix of both walk-ins and those under the DOH Medical Scholarship. So those who had the DOH Medical Scholarship, I think which is under CHED na ngayon, is they are required to go through DTTB within the first 3 years of the return service after passing the boards. So at least in line with UHC, which I will briefly discuss later, we are trying to address the gap in health resource needs in our country. So I'd like to, I believe that our section head for health systems development is here. I think Doc Nelner almost is the better resource speaker here. We can discuss this further later, but I'd just like to mention then that the in line with the Department of Health's 8-point agenda, this is basically the government strategy to achieve universal health coverage. So the 8 points, no, are one, bawat Pilipino ramdam ang kalusugan. 2, ligtas, dekalidad at mapagkalingang serbisyo. 3, teknolohiya para sa mabilis na serbisyo. 4, handa sa krisis. 5, pag-iwas sa sakit. 7, kapakanan at karapatan ng health workers. And 8, proteksyon sa anumang pandemya. So, this is in line with the universal health care, which was enacted last 2019, February 2019, and was signed, and the IRR was signed in October 2019. So I would like to give credit to Doc Melner almost for sharing these slides with me to present this afternoon. So as indicated in the UHC law, all health facilities and insurers will adopt information and communications technology for faster and efficient delivery of healthcare services. So currently, Bohol, which is the province where I'm in right now, is one of the implementation sites of UHC. So with that, we have actually recently developed our primary care provider networks and have created a memorandum of agreement among the municipalities of Bohol to ensure cooperation in the management of the special health fund, which is part of the requirements here of the managerial and financial integration of UHC. Okay, so to share, Region 7, or the Central Visayas Center for Health Development, has established this referral system, also called the Central Visayas Electronic Health Record System, which aims to minimize walk-in consultations at the emergency departments by utilizing the e-referral system. So the gist is that all patients are encouraged to go to the nearest RHU first, and then the RHU is expected to refer the patient to the right facility, the right time, the right place. Ayan. So the system aims for each patient to be navigated through the primary care provider network system. So on the right is the sample chart where you can see when the patient is referred, if the patient is seen from the referral hospital, if the referral is accepted, and then you can click that the ambulance has already departed, then you'll be informed if the patient has already arrived at the facility, if the patient is already admitted, and if the patient has already been discharged. So these are one of the online tools that we can use to ensure that health is really felt by all, and that we can also ensure the smooth delivery of health services, no? Okay, even before the patient arrives at the hospital, the hospital is already can already prepare the equipment and the supplies needed to manage the case prior to arrival at the hospital. So that is a general gist of the context of our healthcare system right now, and specifically in the Region 7, also we have an e-referral system to help us manage our patients. So now I will try to introduce my municipality. And here you can see the sea of clouds of Danao. So actually, below the clouds is Danao. So every morning, almost every morning, para kaming nalulunod sa ulap. Ayan. This is Danao. And Danao is a fourth class municipality of the province of Bohol. We have, and one of our famous sites, aside from the Sea of Clouds, is actually the plunge. Uh, it's near the cave of Francisco Daguhoy. So if you remember our hero, he's the one with the longest revolt in the Philippines, no? So this site is near the cave where they tried to hide back during the Spanish time. No. So again, this is Danao Bohol. This is Bohol, and Danao is here. It's it's an inland municipality somewhere northwest a bit. Danao is composed of 17 barangays, and six of which are considered geographically isolated and disadvantaged areas. So what that means is that either the area is hard to access. Usually, these areas don't have regular transportation. You have to go there with your own private car, or you have to hire like a separate special trip to get to the barangay. Sometimes though it's not just physical na limitation, no, for the area. Sometimes it's also socioeconomic. So if more than 50% of the barangay is considered indigent, uh or if the barangay also don't have access to healthcare, like they perform very low compared to average, they can still be considered GIDA area. So there, out of 17, six barangays of Danao are GIDA areas. So we have a total population of about 20,000 based on the Philippine Statistics Authority census in 2020, and we have 4,446 households. So what we've noted, sorry, so let me just share here. What I've mentioned earlier is our primary care provider network. So what you can see here, I apologize for the abbreviation. So basically, once a patient comes to the RHU, which is here, if the patient needs further or advanced care, which might need admission, for example, we can refer them outside of the municipality. We don't have hospitals in the area. So here you can see how long it takes for them to be referred. So the nearest, I think, secondary or tertiary hospital is Ubay, which is 2 hours away. This is San Miguel Hospital, a few towns away. And then our capital city is Tagbilaran, which is 1 hour and 30 minutes away. This is from another municipality, Congressman Simeon, in Carmen, Bohol. This is in Taribon. So as you can see, the as part of the primary care provider network of North Bohol, we are part of a system of healthcare providers, no? And Danao doesn't have complete facilities to particularly manage all possible types of cases. So here comes in the e-referral system that I mentioned earlier. So when we're referring patient from our RHU, we try to log them into the e-referral system so that one, we know if the hospital is capable of accepting that specific patient. So sometimes we know that our health system um is overburdened, for example. Like what if at that point in time puno ang hospital? So at least the e-referral system could give us an idea if they could accept our patient or not. And yeah, and also here we can see that we don't, like, laboratories aside from the one in RHU are not available in our area. So most important or advanced care requiring cases has to be referred outside of the municipality. This hasn't even included pa, no, like how long it takes from one barangay or from one GIDA area to get to the RHU and how much it costs. So because of the mountainous terrain and lack of regular modes of transportation within Danao, um, these significantly affect the accessibility of health services in Danao. So the average cost of a one-way trip from the most mountainous barangay to the rural health unit is about 30 minutes, 20 to 30 sometimes, and it costs about 100 to 150 pesos one way via a Pacquiao system of motorcycle. So that already so they already have to spend like 200 to 300 for a round way trip just to see the doctor in the RHU. So the 300 is just the transportation cost. We're not also considering how much they have to pay if they need to get diagnostics done, like CBC urinalysis, or if they need medications. So these are the limitations to the access to healthcare, no, because these limitations prohibit most of our indigent populations to even seeking healthcare. Because often the opportunity cost of seeking healthcare is much greater than actually seeing a doctor. So another limitations that we have is the poor information communications technology, most especially because uh, Bohol is one of the areas that has been greatly hit by the super typhoon Odette in 2021. Our Most of our equipment has been damaged. The infrastructure, no, for ICT has been damaged. Towers destroyed. Which I will share earlier, but which I will share later. The pain points of um digital health or information communications in Danao as to the delivery of healthcare. So, in the recent decades, telemedicine has become an increasingly accepted way to provide quality, cost effective, and acceptable healthcare services. So, telemedicine also addresses the challenges of expensive medical costs, time, and distance. It offers a feasible way for healthcare services to reach even those who are in the most remote and underserved areas. So I'd like to share lang one very relevant and significant na historical historical event is the Super Typhoon Odette, really. Kasi after then, uh, Danao had limited to zero signal, no, from December to June 2022. That's 6 months. Imagine how much that could have costed us, no, in terms of productivity. Um, even so, we're only talking about signal, no, like connectivity, but I haven't completely gotten the actual data on how long it took for power and electricity to come back, for water, no. And then since then, even now in 2024, it has not been the same as before. So my nurses used to say na even some barangays could get 4G to 5G data on their mobile phones, pero now almost none. That's almost not there anymore. Like barangay areas try to um build up their own piso Wi-Fi's. So that's the thing now, because the mobile signal has been affected greatly. Some sari-sari stores have piso Wi-Fi's. So that's where you put like a peso coin and then you can have a few minutes of internet connectivity. No. So super typhoon that also damaged our information equipment and infrastructure. So some of our PCs were damaged. Even the RHU itself was almost destroyed entirely. So we have a lying in facility, we have the RHU, we have an OPSEN building and a laboratory building. Sa apat na yon, when I came in 2022, only the laboratory buildings was standing strong, no? So that's where we were holding our consultations. The rest of the buildings were destroyed even a year after the typhoon. So another pain point is telemedicine. So before, the now had a functional telemedicine. Since that was 2021, the before part is definitely the pandemic, no? And because of the lockdowns and the quarantines, uh, the now basically tried to find ways to deliver healthcare, and the now was able to have a functional telemedicine system wherein they allowed consultations online. They had a page for telemedicine, and though we didn't have the actual like the applications with the strict health data privacy systems in place, it worked. Most especially for those who cannot travel to the RHU at that time of the pandemic. So unfortunately, now, partly because as well of the decreased internet connectivity in general, no, for the whole municipality, telemedicine is not being used. And since the lockdowns has been lifted, then so at least they could personally come in to the RHU. However, there is still the barrier, no, of the geographic limitations na. So we just discussed earlier na how much it costs for them just to go to the RHU, and the opportunity cost no, they are losing because of uh, accessing healthcare. And another point I'd like to share is pain points in health reporting. So we know that in the era of digital health and even just running the health system, data and information is very important for us. I know because some of our section heads are here and in the OH, and they know how much data they are requesting from the RHUs not to get reported to the regional office. Like we have daily reportings, we have weekly reportings, and the time that we pass these are noted, no? If we're late in passing reports or not. And the limited access to good mobile signal and internet connection in the barangays has greatly limited uh, or affected our health reporting. So, specifically, there were markedly slow processes of encoding health data for example, iClinic's profiling or MRCA reporting. So, as we report how many kids we have vaccinated during the moratorium no last May 2023, or even encoding of the PhilHealth e-consulta claims. So, in general, these affect as well the operations of the RHU, no, especially the consulta, for example, because this is one of the health financing um, health financing approaches for us to make sure that our operations are running smoothly, aside from the LGU budget. So, with this, um, I'd like to share that the connectivity requirements of Danao is really to have improved internet connectivity, not just in the municipality, but hopefully in the barangays as well, especially in the GIDA areas where we have already the existing telemedicine tools. We already have e-referral system, we have telemedicine already, pero hindi siya makaabot sa areas where it's needed the most because we don't have good internet connection. And hopefully at the same time, not just the infrastructure on the connectivity, no, but also sana the health facilities are equipped as well. Kasi we always, since we are in the typhoon belt and the ring of fire, so we have multiple risks, no, that might uh, threaten our facilities. So like Super Typhoon Adet, wherein many of our infrastructure and equipment were damaged. Hopefully, we could be able to uh, get them equipped once again.